Hi everyone, I'm Steve here with Dr. Nario, and today we're going to talk about cholesterol, a very big topic. And there's people that say cholesterol doesn't matter. Anyway, we're going to get Dr. Nario's opinion. Dr. Nario is at Biointegrative Health Center in Reno, Nevada. As you know, you can check them out online and see all the cool treatments that they do there. Well, I think they're cool. I get them all the time. So thanks for being with us, Dr. Nario.
Hi, Steve. Thank you for having me again. Always a pleasure.
Okay, so high cholesterol. We talked about what you do in your clinic is you will and have used statins as a last resort and probably temporary. But now we're going to talk more about what your first priority is, your first go to, and that is how to lower cholesterol naturally. And first, tell us what is cholesterol? I know we need cholesterol. Cholesterol is important,
Right,
but tell us what is cholesterol? What is high cholesterol? And what does high cholesterol mean to our health?
right. So, Steve, with high cholesterol, it's so misconstrued. There's so many debates about it. But let's start with the
Yeah.
basics here. Yeah, cardiovascular health, yeah, cholesterol is always connected to that. Even hypertension, diabetes, and even smoking. These are the drivers for what we call the cardiovascular risk group. And when you have cholesterol, especially the bad one, so we're going to get into the details of that, it can cause inflammation, oxidative stress, and even revs up your immune system in a bad way. And genetics plays a role. Nutrition, definitely, as we all know, the sad diet, right? And here's one thing that kind of struck me: infections. If you have higher infections in the body, if you're sick, these cholesterol particles actually helps to contain this infection so that it won't spread and even helps it get destroyed, right? So even
So
huh
let me ask you there.
yeah,
So
yeah.
are you saying if you have an infection, your body's going to make more cholesterol
Yes, that is correct. So
to protect okay,
right,
interesting.
so that's that. I mean, it's not new to me, but every time I hear about it, wow, I never thought of that or never heard of that in medical school. So that's
So
why.
there's
Uh-huh.
reasons why your body makes cholesterol. That's
Right,
important.
right, right. So, and then also smoking, as we all know, and alcohol also causes the aggravation of these cholesterols to go up. And also, when lack of exercise, we spoke about being sedentary. That's also a big factor to this. So, and that's why these things. It's always a reminder for our patients on what cholesterol pertains to. And when we talk about cholesterol, it's not all bad. Cholesterol is being used in our bodies for brain function, mitochondria, even the mitochondrial structure, the cell walls. So we have creation of steroids, sex hormones, and even vitamin D3. And these are just simple things, and it's being created also in our liver, intestines, adrenals, and even an ovary in our ovaries and testes. And that's why cholesterol. There's a lot of debate. LDL, bad cholesterol, I would just want to remind everybody, is not all bad. It has to be modified so that it can be bad to create disease. So not all LDL, when you look at the cholesterol panel, will do damage to you.
So I know in the clinic that you offer a lot of specialized supplements for multiple different things and more stuff that I think is really cool, just the different supplements that you have for different things. But I know that you will offer supplements or talk to your patients about cholesterol, maybe lowering cholesterol. Why do you use that approach with supplements? What's the deal there? Um, Supplementation for cholesterol.
Well, Steve,
I mean,
yeah, you're
I know that's like your first choice to go that direction. Well, I mean, but maybe diet or whatever. But just explain that a little bit.
right. So with cholesterol, I mean, again, there's so many ways in how to treat it. We just discussed the significance of cholesterol medicine, but in this day and age, there's just so many reasons why um, patients actually look for alternatives, and it's not always a one size fits all type of deal. There are reasons that people, let's say, tried cholesterol medicines and they didn't have a good reaction, or allergic responses, as we call it. And even just perception that there's just so much stereotyping out there that I have patients who, oh no, I'm not going to take a cholesterol medicine just because I might have these side effects. So they haven't taken it, but they're just afraid of it. And even just for a personal preference, there are patients that are like, I'm all natural. I'm not gonna do it. I'm just gonna go for the naturals here. And when you approach cholesterol problems, there are three ways in how you can do that. One is nutrition. So this is like the food, the diet. Another one would be nutraceutical supplements, vitamins, antioxidants, and minerals. And lastly would be herbs. So these are going to be like the Chinese medicine and even herbs, actual plants that you turn into a tea or leaves. So those are the different options that we give to our patients.
Yeah, and I know a lot of these supplements and things that you're going to talk about. I'm going to ask you about three different recommendations, but I know that a lot of these are very effective. And hey, I listened to the last interview that you and I did, which was on cholesterol and statins. And it's like, I'm kind of on the side of what you're describing. No, I think maybe I'll just take my chances and die instead of take that. When you start talking about all the things that could go wrong, like you hear on the commercial. I mean,
Right.
two-thirds of the commercials are like, okay, why would I do that? So I get that.
Mm-hmm.
I get it. And I'm kind of more in that ballpark.
Mm-hmm.
Well, I'm completely in that ballpark, to be completely honest. But so your top three recommendations, is that a combination of lifestyle changes?
Mm-hmm.
Is it supplementation? But what are your top three recommendations? And then maybe at the end, throw us a bonus, something that's maybe not in your top three, but maybe still beneficial if you have one or two of those. So,
Right.
what's your top three recommendations?
Well, Steve, you're right. We want to make sure nobody's going to die, right? We're going to them all intact. We're going to be making it safe. And the thing here is, when I always talk about intervention, I always want to emphasize about lifestyle changes. You're right. Exercise, less stress, and diet. And in this situation, I want to emphasize also that supplements are only supplements. They're going to help these three main interventions for cholesterol. And I want to focus on just supplements. Maybe we can have another segment for like what type of food sources that can help with cholesterol. So top supplements, I always have my top three. One of them is niacin. So niacin is vitamin B3. And on studies, it actually had shown to lower triglycerides, it lowers free fatty acids, it prevents clotting even, and also it actually works best in the dosing of around 500 to 1,000 milligrams per day. And it's even comparable to the medications that are out there, like fenofibrate. You will hear this medicine in whenever you visit your doctor's clinic. And it also lowers down the possibility of any cardiovascular disease by 30%. And as I mentioned to you, it's just like a jack of all trades. Anti-inflammatory, antioxidant, reduces inflammatory changes in the arteries. That's why it's one of my favorites. And you can go up to 1 to 4 grams with this, but there are side effects though. So these are the ones that people should take note of. It can increase your blood sugar. It can actually cause a lot of flushing, the hot feeling. It's like a hot flash. People will always notice that when, especially like it's comparable to menopausal hot flash. And even, of course, real regular reactions to medicines like rashes, itchiness. And again, when you have these things, there are some ways to negate that. So for the ones who are doing niacin, just make sure you increase the dose slowly. You can take an apple along with your food or with niacin. All you can take it with food or an apple to be specific, because apple has quercetin, and quercetin lowers down this niacin flush. Or you can actually take the supplement quercetin of 500 milligrams once or twice a day. Don't take alcohol while you're on niacin. Don't interrupt the treatment, or you can even take a baby aspirin with that. So that's why I like this medicine or this supplement, just because it has so many things that can help your problems for.
Okay, so
So that's number one.
niacin. That's one. Niacin is amazing.
Mm-hmm.
Yeah, for sure. And that's there's two forms I know. Nicotinamide is B3 and niacin is B3.
Mm-hmm.
But what you just described is amazing. And you guys talk to your own doctors about niacin because it is amazing. So,
Right.
what's number two?
Number two is the famous red yeast rice. So red yeast rice actually has the active ingredient called monocolines, and this is used in the range of 3 to 10. I guess these are low doses, milligrams, and you can go as high as 2,400 milligrams. You take it at night because they describe Chinese red yeast rice as statin-like. It's almost comparable to a statin, and it lowers down all the parameters of bad cholesterol, LDL, total cholesterol, triglycerides, and you can see this in your lab test also. The thing here with red yeast rice, though, it actually has a again, we people like to buy over the counter. The problem with over the counter products would be contaminants. So the contaminant actually is called citrinine. So if you get the wrong product, this is a toxic fermentation. It's actually made by mold and actually will induce renal issues. So it will destroy your kidneys. That's why I always tell patients buy red yeast rice from a reputable source because majority of these unfiltered or unchecked products does have all of these mycotoxins in them. And again, when we talk about statins, it's famous for muscle aches. If the patients are taking statins and they suddenly have muscle aches, this is a good alternative for that. It doesn't mean it's not going to have it, but it actually has less of this type of side effect. So that's why it has this moniker of statin-like or replacement for statins. So that's why I like this.
Well, yeah, make sure you get a good product, everybody. Okay, so what's your third supplement to help lower cholesterol?
So the last one is my most favorite, and I take it personally, is omega-3 fatty acids. It actually it has so many numerous clinical evidence to back it up. It lowers cardiovascular disease, heart disease, MI, strokes, even sudden death at 45%. Will you not take that? It's almost like 50%. It kind of gives you a life insurance right there. And the limits here would be around 4 grams. You don't want to go over because there are some controversies about it promoting atrial fibrillation. So, but again, it depends on the situation. I have patients who are on higher doses, but your doctor needs to evaluate that for you. And we all know it's a good anti-inflammatory for people who has joint pains and even just generalized inflammation. It lowers down the clotting capabilities of your blood, increases nitric oxide in the body, and also it's something that is when you will hear other kind of lookalikes of omegas like krill oil, right? Does it also have that effect compared to fish oil? So on studies, it actually had proven that it can lower the triglycerides and even some bad cholesterol. But the thing here is, it actually takes longer, and we have to remember krill oil is very expensive. So that's why I still end up giving my patients regular fish oil. So just make sure you get it from a reputable source because it always kind of when they have a smell, it gives you a burpy feel or nausea feel after that. It's probably called rancid. So it's not the best type of fish oil to get out there. And you can get this from good, reputable sources. So, fish oil, one of my personal favorites.
That's for sure. You got to make sure you get it from a good, reputable source and it's high quality. Okay, Dr. Nario at Biointegrative Health Center in Reno, Nevada. We appreciate your input. Thanks for being with us, and we will see you next time.
Well, Steve, thank you again for having me. As we all know, knowledge is power, and thank you for letting me provide you with the edge on longevity and health maintenance, which I call the biological edge or the bio edge.